Dear colleagues, I represent a team of doctors and engineers from St. Petersburg, Russia, who have been developing the devices for thermopuncture diagnostics and treatment on the basis of a cabana test for more than 20 years. One of the direction of our device application is a system for early diagnostics and individual monitoring of diabetes. This pathology has been well studied by us, based on the data from monitoring of more than 900 patients with diabetes. Earlier, we discovered the same indicator of a cabana test are correlated with glycemia level and with other biochemical parameters, which can be evaluated from the test result by calculation method. So it became possible to estimate functional state of patient with diabetes and other diseases on a new physical principles. Near 3 years ago, studying the effect of insulin on diabetics, according to the test, we found that the effect of properly selected drug and its dose is associated with restoration of symmetry in the body. On this fundamental basis, a new technology for individual assessment of action of various drugs can be built.
It is known that all living things are asymmetric, but this asymmetry obeys the laws of harmony, and usually does not exceed 10 to 20%. In case of illness, the asymmetry increases sharply. For example, if a plant is sick, then spots or growths appears on its leaves, asymmetrical in relation to the midline, by which the disease can be identified by their specific location in 12 symmetrical leaf sectors. The human body also has axial symmetry, but the problem is that many organs are not paired and asymmetric in structure. From the foundations of Chinese traditional medicine, it is known that the human body also has 12 main symmetrical acupuncture channels that control the main organs and systems. This slide shows the topography of the points on the pancreatic canal. This gland itself is an asymmetrical and non-paired organ. However, its diagnostic points on the acupuncture canal are symmetrical on the right and left sides. In such cases, we found that information about the violation of symmetry can be carried by temperature pain sensitivity thresholds indicators. According to the Akabane test, at certain diagnostic points of the acupuncture canals, which are symmetrical with respect to the medial axial line of the body. At the same time, normally in paired and unpaired organs and systems, the indicators of the right and left branches on the acupuncture canal are almost symmetric, and in pathology this symmetry is sharply violated, which allows to make certain diagnosis, according to the general profile of the test. A popular proverb says that, "There is nothing new, except what was forgotten." In this connection, it would be interesting to pay attention to the possibility of diagnosing and treating different disease, from the point of view of traditional Chinese medicine and acupuncture, which has 2,000 years of history. In order to quantitatively evaluate a channel's activity level in TCM, the so-called sacrificial stick test was used in ancient times in China. This test involved a burning sandal stick, which was brought in time synchronously with the pulse rate to specific diagnostic points, at the tips of the fingers and toes until the first sensation of pain. At each point, the number of heat passes is calculated until first pain feeling. If the number of heat passes was lower than the average one for all the channels, it proved the hyperactivity of channel and its corresponding organ. On the other hand, when the number of heat passes was higher, it represented the inactivity of an channel and its corresponding organ. This test was re-described by the Japanese Dr. Koban Akabane in 1952. Since then, the test has carried his name. Temperature sensitivity is the main defense system of the body, which provides a lot of information about its individual characteristics. The main task is to correctly decipher this information. On this basis, in 20 years, we have created more than 10 versions of modern devices for diagnostics and correction according to the Akabane test. From the modern physiology point of view, the idea of channel energy in TCM is equivalent to notion of organs' functional activity, connected to each of these channels. So, as a result of 3 to 4 minute test, we get digitally coded information of individual functional activity of main organs and systems of a body. For comparison, consider two tests, a healthy person and a diabetic patient. Normally, the indicators of the right and left points, on the same channel, do not differ much. In diabetes, there is a violation of symmetry in certain channels, which generally increases proportionally to glycemia level. Thus, it is possible to identify those systems and organs that are suffering from a particular disease. In our study, we used a special certified device, Refleximaster. A total of 225 patients, with type 1 and 2 diabetes were examined at different times, before and after insulin injections. This slide shows the profiles of pain sensitivity for type 1 diabetes, in comparison with norm. On x-axis, these are 24 channels, along the y-axis, average number of thermal pulses along each channel. As can be seen from this graphs, the greatest difference with norm for men and women mostly appears in liver and pancreas channels. These differences are more noticeable for women. If temperature sensitivity of the channels changes, the level of glycemia changes synchronously with it. But, temperature sensitivity changes occur before the change in biochemical parameters of the blood, due to its buffering properties, and this makes it possible for early correction. Generally, acupuncture channels work as a specific signaling system in the body, but it is necessary to learn how to decipher these signals. The main evaluation of test profiles is based on 3 simple principles. First, the presence of high indicators for the Acebane test means hypofunction of the channel and its associated organ. The higher the temperature sensitivity index, compared to norm, the higher the degree of functional or organic disorders. Second, deviation of temperature sensitivity indicators. The presence of such deviation indicates a significant role of the channel itself in leveling the manifestations of diabetes. If blood sugar level changes, the channel indicators changes too. Therefore, high values of deviation should be considered as a factor of compensation for organism resistance to the unfavorable internal conditions. If there is no deviation through the channel, then this system does not participate in regulatory processes, and has little prospect for corrective interventions during treatment. 3. Very important difference between diabetes and norm consists in a sharp violation of symmetry between the left and right sides of some channels. For healthy people, there is also an asymmetry between the right and left sides of the channel, but usually, it does not exceed 10 to 20%. As a rule, the indicators on the right side exceed left. As a result of these observations, the most important information about metabolic disturbances state in the body can be obtained from the graph with the ratio of right and left sides of the channels. This presentation of the information for each patient is important for his treatment, because in each case, the target channels for correction are visible. The goal of treatment is to eliminate these asymmetries and create harmony in the body at the level of its bioenergetics. In general, the right side reflects anabolic processes, and the left, catabolic processes. Therefore, if they are equal, there is an energy balance. According to this slide, the maximum metabolic disorders are observed through pancreas and liver channels. For patients with type 2 diabetes, there is a large difference in symmetry disturbance between men and women. For men, disorders mainly occur in the channel of the pancreas, stomach and lungs. For women, mainly in the liver, stomach and pancreas. Step-by-step regression is the most effective tool for evaluating regulation mechanisms of carbohydrate metabolism. This allows us to identify the vectors and influence coefficients for each channel in this process. For patients with confirmed type 1 diabetes and partially retained pancreatic function, the most significant regression model of relation with blood glucose levels, was obtained, which is practically identical for men and women. In this model, the right branch of the liver and pancreatic channel has the greatest positive influence vector on glycemic levels. Its growth reflects the growth of glycemia. In contrast, the left branch of the pancreatic channel and the right branch of the stomach channel have negative influence vector. Based on these observations, it is logical to display the following scheme of reflex connections to the pancreas, where the right diagnostic point of pancreas channel reflects beta cells activity, and the left reflects alpha cells activity. At the same time, the asymmetric growth of pancreas parameters of the right branch channel corresponds to the proportional hypofunction of beta cells, which leads to hyperglycemia growth. So, there is a kind of carbohydrate balance. On one side, with the positive communication vector, there are right channel pancreas points that reflects the increase of glucose level in the blood. On the other side, there are left points whose growth also reflects a decrease in glycemia. Which of the sides will weigh in that direction, the nearest change in glycemia will be. Normally, these sugar scales are in constant motion and form the endogenous biorhythm of the pancreas. So, optimal blood sugar values are normally maintained. If the organ does not work, biorhythms are absent, and test parameters are always the same, at different blood sugar levels. The endogenous biorhythms of various organs can be determined from the data of several tests, in the dynamics of observation, using the programs of cosigner analysis. Dedicated biorhythm can be extrapolated for the future, and thus the glycemic level can be predicted. Let us assume that the individual regression model of the connection with glucose includes channels of pancreas, kidneys, and gallbladder. All of them have different oscillation periods and phases in time. Thus, according to calculations, the glucose level can also differ significantly, due to sharp fluctuations in the total vector of effects of several channels, as a consequence of their biorhythms interference. This concept explains why, under strict conditions of nutrition and treatment, the level of glycemia is not stable for patients. This slide contains summary biorhythmic activity of pancreas, liver, and kidneys, based on observation test results for 38 days. Different channels have different period of activity. This slide shows graphs of real biorhythm interference that results in significant changes in glycemic levels at different times. Creation of such individual control system will allow to predict the patient's condition for 1 to 2 days in advance, with the possibility of changing the dose of drugs to prevent crisis situations. Now, to monitor the condition for various diseases, we have launched the production of simple individual certified Chemaster devices that work via a smartphone. To select the type of treatment for both types of diabetes, it is necessary to construct a regression model based on learning measurements. This usually requires at least 10 to 15 tests, with large fluctuation of glycemia level. After this, it becomes clear which channels really affect on glycemia level. This principle is shown on the slide in relation to type 2 diabetes, where two channel groups have different vectors of influence on glycemia. Taking into account their influence coefficients and rhythmic characteristics, it is possible to predict the glycemia level and calculate the optimal time for taking sugar-reducing drugs and their dose, taking into account the rules of chronopharmacology. Similarly, this technique can be applied to monitor other diseases. This article contains analysis of regression models for links between glycemia level and channels for men and women with type 1 and 2 diabetes on the basis of a large statistical material. Then, in a similar way, the effect of different types of insulin and their dose on channels was assessed. This slide, in a pivot table, presents the resulting data from such comparisons. It shows only those channels that most reliably reflect the relationship with glycemia level and with type and dose of insulin. In general, it was found that the effect of insulin, in the optimal case, extends to the same channels that are affected by the level of glycemia. Only the side of the channel or the vector of influence changes to the opposite one. Thus, if for example, in type 1 diabetes according to the general model, an increase in the glycemia level is accompanied by a proportional increase in the indicator of the right branch of the pancreatic channel, then the effective action of insulin should be accompanied by an action on the same branch of this channel, but with the opposite sign of influence, which leads to a decrease of asymmetry level. There may be another effect of insulin, when the indicator of the left branch of this channel increases and the asymmetry also disappears. Comparing individual models of influence of glycemia and insulin on channels, in each specific case, one can see how fully a particular drug affects the entire list of channels in which, under the influence of a disease or other negative effect on the body, a violation of symmetry occurred. In each specific case, the number of such couplings is taken into account. The result will be optimal when, under the influence of a medicine or dietary supplement, the restoration of symmetry has occurred everywhere. The cure for the disease then works like a key to a lock. However, this effect is not always observed. In this case, you can apply several drugs or dietary supplements that are different in their effect on the channels, which will generally restore symmetry and harmony in the body. This is a general universal principle, which has been tested over many years of work for various diseases in the treatment of various medicines. This slide shows the principle of selecting the optimal dose of a drug, using the example of the action of insulin on the pancreas channel. Initially, under the influence of 10 insulin units, the indices of the right and left branches of the pancreas channel were aligned, with the restoration of harmony. In the case of using of 30 insulin units, the indicator of the left branch will exceed the right one, and their ratio will be less than 1, which is already characteristic of hypoglycemia. Recently, our new article was published, which shows, using a clinical example, how this technique is carried out in reality. To carry out such monitoring, user needs to make a series of measurements, before and after taking medications at several points, and build graphs of asymmetry changes at different points, which is quite cumbersome in practice. Therefore, over the past 20 years, we have been looking for a way to constantly assess channel activity over time, through analysis of pulse wave parameters. Recently, such a solution has been found using phase and spectral analysis, and we are planning to launch this system in an individual device in the near future. In this case, the monitoring procedure is radically simplified. Through a heart rate sensor, for example in a watch, information is sent to a smartphone, where data is continuously processed. This slide shows 3 main types of response to treatment over time, using insulin as an example, obtained through continuous monitoring with a pulse sensor. In the case of an optimally selected dose, for example insulin, the asymmetry becomes equalized. Normally, it corresponds to fluctuations of 10 to 15%. If insulin or another drug does not act on this system, then the asymmetry persists. In the case of an excessive dose of medication, or dietary supplements, or improper nutrition, for example after a large dose of alcohol, an inverse asymmetry occurs, which leads to new complications. This principle is universal. All diabetes monitoring systems are now based on assessing blood sugar levels. However, the level of glycemia is the final product in the chain of various organs' interaction and systems of the body. With such an assessment, it is difficult to determine individually where the underlying disorders occurred, and how different medications affect on the disease. Therefore, most patients are treated according to the general scheme, without assessing the individual characteristics of the organism.
Of course, in this short presentation, we have only covered the main components of this technology. which is based on fundamental principles of symmetry and asymmetry in nature. In this case, the essence of a treatment is restore harmony in the body. It seems that Einstein said that the new idea are the mother of all rich on the earth. We think that this idea will allow creating new methods for monitoring and treating different patients. We see our task in connection with Eastern and Western medicine with one conceptual bridge. You can learn more about this technology in our websites. Thanks for your attention.